Everybody, I'm back again. This time we're going to talk about planks and side planks because we've had, again, some of our fall athletes coming in injuring their backs when they're going under plank, and we just want to modify it a little bit. A plank is a really great activity to work your core if done correctly. The problem is a lot of times when we go under a plank activity, people are going from a hyperextended state where their pelvis is falling forward and ribs are coming apart. So it actually ends up being a good workout for your back and your hip flexor. And quite honestly, I've been a physical therapist for over 20 years. I've never encountered an athlete that's had a weak back. It's not that backs are bad, but I've just never had to strengthen a back. But I have had to strengthen abs. And abs that we're really after in our clinic to help a good throwing athlete or to help Grandma Dynamite, as my friend James would say, to be able to walk out to their car, to be able to have asymmetrical activity occurring on either hip. We like the outer abs called the internal obliques and transverse abdominis muscles. These muscles, your transverse abdominis muscle acts like a little corset that goes around here, and your internal obliques attach from the distal part of your rib cage and come down and attach to your pelvis. And if these muscles are put in the right position, they help to integrate your pelvis and your trunk, which anyone needs in everyday life to walk. So when I take a step forward, my left abs are helping to keep me in the right position to allow my right leg to come forward with my left arm in a good biomechanical position. So when you're doing your plank, we want to make sure that your elbows underneath your shoulder. You're going to bring your feet out, but you do not want to drop. This is a hyperextended state. If you push in and tuck your bottom just to neutral position, you're going to hold this position. You're going to get a great shoulder workout. You're going to work your abs and hold this position, and you're not going to feel your back or your hip flexors. And this would be a good position to hold with your athletic event. So hopefully you can see a good plank and a neutral plank in the position that I did it in today. Something else I want you guys to keep in mind, because sometimes we do side planks, your left abs are always going to be weaker than your right abs, and I would strongly encourage any athlete to work their left abdominal left abs more than their right. If you want to know, I will explain it to you, but it's probably outside the scope of this video. But when you do a side plank, working your left side maybe a little bit more, just a little tip, keep your elbow underneath your shoulder. When you go to do your plank, think about maybe putting your right foot ahead of your left to assist you to keep your left hip back. If your right hip comes forward, you're really going to hold yourself up more with your back and your right ab. But if you can keep this left hip back and hold this plank activity, you're going to really put your left abs in a more optimal position. I hope that helps. Have a great day.